Hi everyone, welcome back to Living a Balanced Life with Julio. On today's episode, we're going to talk about our bone health. So we're going to talk about how you can improve your bone health, prevent osteoporosis to live a healthy, balanced life. If you're interested, please stay with me.
Exclusive.
Osteoporosis is a disease that causes your bone to become very thin, resulting in a decrease in bone strength. This leads to increased risk of fracture, like broken bones, particularly of the hip, the spine, the wrist, and the shoulder. Osteoporosis is often called the silent thief because the bone loss occurs without any symptoms and without you knowing that's happening. Don't get osteoporosis confused with osteoarthritis. Osteoporosis is a bone disease, whereas osteoarthritis is a disease of the joints and surrounding tissues. Osteoporosis is not a normal part of aging, and it's more common than many women realize. At least 1 in 3 women will suffer a broken bone from osteoporosis during their lifetime. Broken bones among Canadian women are more common than heart attacks, strokes, breast cancer combined together. Women begin to lose bone in their 30s at a rate of about 1%. As they approach menopause, women lose bone at a greater rate, from 2 to 3% per year. There are many ways you can help improve your bone health to prevent osteoporosis. Usually, women age 50 are at a greater risk of developing osteoporosis. Over 80% of broken bones after the age of 50 in Canada are caused by osteoporosis. Fewer than 20% of women who suffer a broken bone are checked for osteoporosis. 2/3 of spine fractures are painless, and so making sure that you are getting your heights checked once a year when you're over the age of 50 is a good way for you to know that you haven't developed osteoporosis, because height loss is an indication of osteoporosis. 2/3 of spine fractures are painless. Height loss may be an indication of undetected spine fracture. Women 50 years plus should have their height checked annually, like I said earlier. Women 50 plus are recommended to ask your doctor for a fracture risk assessment to determine their risk of a broken bone over the next 10 years. It's very important as women for us to take bone health very seriously, because osteoporosis occurs mainly in women. Men can get osteoporosis too, depending on their risk factors. So depending on what condition they have, what medication they've taken in the past, because those could be increase their risk of developing brittle bones, which is osteoporosis. Women 65 and over are recommended to have a bone mineral density test done. This is an x-ray that is done. Usually women age 65 plus, or if you're age 50 and you have an increased risk of osteoporosis, could be done for you to know where you're at in terms of checking your bone density to see if your bone is dense or if your bone is becoming thin and brittle because of osteoporosis. Falls are a major cause of fracture. 1/3 of women over 65 falls each year. So make sure you take measures to prevent falls in your home and in the environment that you live in, because there's such high chance of you fracturing your bone, and this can lead to other complications for your health. Osteoporosis can cause a fracture called fragility fracture. This type of fracture caused by osteoporosis is known as fragility fracture because it occurs spontaneously or when you trip or slip or have a minor fall, pick up a child or an object, make a bed, or complete other simple tasks. Even a cough and a sneeze can cause this fracture. Fragility fracture is caused by events that won't cause a bone to break, like sneezing, coughing, picking up a child, picking up an object. So it's important for you to take care of your bone health to help your bone become strong, prevent fractures, prevent complications of osteoporosis. The consequence of fragility fracture can be devastating and may include chronic pain, loss of mobility, loss of independence or institutionalization. So it can cause depression, social isolation. It can cause fear. The fracture can happen over and over again. So 1 in 3 hip fractures patient and 1 in 5 spine fracture patient will refracture a year after their first fracture. Death, 25% to 28% of women who suffer a hip fracture will die within the following year. So this is not just as simple as breaking a bone, because there's other complications that's associated with fracturing, which osteoporosis makes it worse and can lead to complication and to death. Some of the risk factors for osteoporosis are out of your control. That include your sex. Women are more likely to develop osteoporosis than men. Age. The older you get, the greater your risk of developing osteoporosis. Race, family history, people with small body frame. Actually, women with small body frame have a higher chance of developing osteoporosis. Women over the age of 50 or postmenopausal women have the greatest risk of developing osteoporosis. Women experience rapid bone loss during and 5 to 10 years after menopause. Menopause decreases the production of estrogen, a hormone which your body needs to protect against excessive bone loss. Loss of menstrual period in young women also cause low estrogen level and osteoporosis. This can occur if a woman has low body fat, like in diseases like anorexia nervosa. Chronic diseases such as rheumatoid arthritis and chronic hepatitis C, which is an infection of the liver, can all increases a person's risk of getting osteoporosis. Irritable bowel syndrome and hypothyroidism are all examples of conditions that can lead to brittle bones, which is osteoporosis. Deficient in vitamin D, which is the sunshine vitamin, can also lead to a person developing osteoporosis. Cigarette smoking, excessive alcohol, and caffeine consumption can also lead a person in developing osteoporosis. Lack of exercise and a diet low in calcium can also affect a person's risk of getting osteoporosis. Poor nutrition and poor general health are all risk factors of osteoporosis. The good news is that there is so much out there that can help you make your bone healthy, make your bone dense to prevent osteoporosis and its complications. The main purpose of osteoporosis treatment is to increase your bone mass. This will help reduce the risk of fractures and also help avoid any additional decrease in your bone density. It is important to talk to your doctor to determine if osteoporosis medication is right for you. For both men and women at increased risk of fracture, the most widely prescribed osteoporosis medications are bisphosphonate. And bisphosphonate comes in different forms, depends on the brand and what your doctor thinks will fit your medical history. Some of the other pharmaceutical intervention or treatment for osteoporosis include, besides bisphosphonate, include estrogen therapy, salmon calcitonin therapy, and other therapies. So, or you've been diagnosed with osteoporosis, the best is to speak to your healthcare provider and get the right treatment that will fit your medical needs. Some of the ways that you can improve your bone health to prevent further bone loss is to make sure that you include the non-pharmaceutical intervention, which include calcium and vitamin D supplementation, weight-bearing exercises, muscle strength exercises, and fall prevention. This is very important to include because they will prevent further injury if you have osteoporosis or if you don't have osteoporosis, to improve your bone health. Calcium is an essential nutrient required by all parts of your body. The bone, which are made up of largely calcium, act as a calcium bank. So that means if we do not eat enough calcium, our body will will take the calcium from our bones. So if you don't eat enough calcium, your body will take the calcium it needs from your bone. And in doing so, can make your bone weaker and more brittle and easy to break and can develop osteoporosis. Milk products are an excellent source of calcium, but since it's not always possible to obtain enough calcium from your diet, a supplement may be necessary. But before you start any supplement, it is important to speak to your healthcare provider to make sure that right blood work is done, right imaging test is done to prescribe what's needed for you. So how much calcium do you really need? Women ages 19 years to 50 years require about 1,000 milligrams of calcium per day, whereas women 50 years plus require 1,200 milligrams of calcium per day. You can get calcium from your diet by consuming a healthy diet. So diet that are high in milk products can help boost your calcium levels. So dairy products such as cheese, milk, and yogurt are a great source of calcium. Dark leafy green vegetables such as spinach, kale, collard green, broccoli are all high in calcium. Fish with edible soft bones such as sardines and canned salmon are all good source of calcium. And also calcium fortified food and beverages such as soy products or almond milk and some of the nut milks are all excellent source of calcium for you. Another important vitamin to make sure that we're getting that's essential for bone health is also vitamin D. Vitamin D is called the sunshine vitamin because the body makes it through exposure to the sun. For those people that live in places like Canada, because the sun is an unreliable source of vitamin D, supplements are recommended for all adults all year round to make sure that you're getting the vitamin D that is needed to other body functions, including your bone health and preventing osteoporosis. The amount of vitamin D that you need in a daily basis depends on your age. So from people aged 19 to 50 years of age, the vitamin D recommendation is 400 to 1000 IU unit per day. And for people 50 plus, the vitamin D recommendation is 800 to 2000 IU unit per day. So in order to make sure that you're getting these amount of vitamin, you have to make sure you're supplementing it through your diet. So you're eating foods that are high in vitamin D and also making sure that you are being exposed to the sun at least 15 to 30 minutes every day if you can. And if you're not getting sufficient sun exposure because of the weather and the climate of where you live, you need to supplement it by taking your vitamin D pills prescribed by your healthcare provider or your doctor to make sure that it's specific to you. You never start taking any vitamins or minerals without speaking to your healthcare provider because they need to be able to advise you based on your blood work and your current health. Vitamin D is very important to our bone health because vitamin D is a key component in processing and regulating calcium and phosphate in the body. The nutrient also works hard to maintain proper bone density. The most efficient way for the body to get vitamin D is through exposure to sunlight, like I said earlier, because vitamin D is needed in order for you to absorb calcium properly. So even if you are eating a diet that's high in calcium and that's very good for you, and your vitamin D level is very low, your body will not be able to absorb the calcium properly for you to use it for all the different body function, including boosting your immune function and preventing osteoporosis. You can get vitamin D through your diet by eating foods that are high in vitamin D. Foods that provide vitamin D include fatty fish like tuna, mackerel, or salmon, foods fortified with vitamin D like some dairy product and some beverages, soy milk and cereals. Cheese has vitamin D. Egg yolks contain vitamin D. So these are all some of the foods that contain vitamin D. But in order to get enough for you to sustain your health and prevent osteoporosis, boost your immune system, and to function for all the other body function, it's important for you to supplement vitamin D because we don't get enough sun exposure, especially if you live in places like North America. Some of the other nutrients that you need to improve your bone health include protein. So protein gives bone its strength and flexibility and also contribute to muscle strength, which can help prevent falls. So if your diet is low in protein, you might want to increase your protein. And protein, you can get it from plant source or animal source. They're all good for you to help you maintain a strong, dense bone. Also, vitamin C, vitamin K, potassium, magnesium, and other important nutrients can be obtained through a healthy diet, especially a diet that is rich in fruit and vegetables. So making sure that you're eating a balanced diet, including your vegetables, your fruits, is a good way for you to maintain overall health, improve your bone health, and prevent osteoporosis or help prevent complications of osteoporosis. Some of the other ways you can improve your bone health by preventing osteoporosis or to maintain a healthy bone if you have osteoporosis is to limit your alcohol consumption. So making sure that if you do drink, you do drink within the recommendation of no more than 9 drinks per week for women, and for men no more than 14 drinks, standard drinks per week for men. Make sure that if you smoke, to quit smoking because smoking increases your risk of osteoporosis. We talked about eating a balanced diet, making sure that you're exercising. So exercise is very important for all women to build muscle strength, help prevent falls, protect the spine, and to slow down the rate of bone loss. Different types of exercises are needed: strength training, posture training, balance training, and weight bearing. Aerobic physical activity is recommended for you to do to help you maintain a healthy bone and to help you prevent osteoporosis. Exercise, as long as you're getting your 150 minutes per week, is recommended. So if you do any kind of exercise like walking, dancing, swimming, they all count as aerobics exercise, but make sure that you're including resistant type of exercise, the exercise where you're working against your body weight or working with weight to improve your muscle strength, to improve your overall bone density and bone health. Another important vitamin that you must include in your diet to help improve your bone health is vitamin C. Vitamin C is important for healthy gums and healthy bones. Vitamin C is essential, very important to the formation of collagen, which is the foundation of bone mineralization it builds on. Vitamin C is also associated with increased bone density. So in making sure that you are adding vitamin C to your diet, which you can get it from fruits and vegetables, is essential for your bone health to prevent osteoporosis. Vitamin C is a water-soluble vitamin, and most people do not absorb it properly in their intestine, especially the elderly and those that smoke. So this is a good reason if you smoke to quit smoking. Good source of vitamin C, like I said earlier, include your vegetables and your fruits like broccoli, bell pepper, cauliflower, kale, lemons, orange, papaya, strawberries are all good source of vitamin C, which can help boost your immune system, help you fight infection around the ear, and also keep your bone very strong to prevent osteoporosis. Vitamin K is another vitamin that's important for your bone health. Vitamin K helps your bone attract calcium to the bone. So low blood level of vitamin K are associated with low bone density and possibly increased fracture risk. You can increase and boost your vitamin K level by eating a healthy, balanced meal, including your vegetables and fruit. So vegetables like broccoli, cooked broccoli, Brussels sprouts, cabbage, using colonna oil, kale, olive oil, parsley, spinach, and Swiss chard are all a good source of vitamin K. Vitamin K is essential, but it's important for you to have your vitamin K level checked or have your blood work done to know what your level before you take any supplement. Vitamin K supplement is not necessary to improve bone health. Just making sure that you're getting it through your diet is essential. People that are taking blood thinners should be careful with the amount of vitamin K that's in their blood, because we don't want your blood to be over thin where you can bleed easily. So vitamin K supplement is not necessary, but you can get it through your diet. Make sure you're following all the diet and recommendation from your healthcare provider who has a bigger picture of your health, because they have your blood work and your medical history to make sure that they're providing tailored care to you. So healthy eating is very important to your bone health, making sure you're getting all the essential vitamins and minerals that your body requires to make strong, dense bone to prevent osteoporosis. So more tips on eating for good bone include, for example, if you're someone that like to use legumes like beans, beans are a very excellent source of protein, which is also needed for bone health. But while beans contain calcium, magnesium, fiber, and other nutrients, they also are high in a substance called phytate. Phytate interferes with your body's ability to absorb the calcium that is contained in beans. You can reduce the phytate level by soaking your beans in water for several hours before cooking them. So this is a good way for you to reduce the phytate which is in beans, to help you get the benefit of eating the beans, getting the fiber, the magnesium, and the calcium that's contained in the beans. So soak your beans in fresh water for several hours to reduce the phytate level before you cook it, to get all the benefit from the beans. Another health tip to help you improve your bone density to prevent osteoporosis include making sure that you are controlling the amount of salt that's in your food. Eating foods that have a lot of salt or sodium causes your body to lose calcium and can lead to bone loss. Try to limit the amount of processed foods, canned foods, and salt added to the food you eat each day. To learn if your food is high in sodium, look at the nutritional facts on the food label. If it's less than 20% or more of the daily value, it is high in sodium. Aim to get no more than 2300 milligrams of sodium per day. This will help you not only with your bone health, but also help you prevent heart disease like high blood pressure and other complications. What you drink with your meal or throughout the day also have an important effect on your bone health. Alcohol, too much of it can cause your bone to become more brittle. Drinking heavily can lead to bone loss. Limit alcohol to no more than 2 drinks per day for men and 1 drink per day, standard drink per day for women. This will help improve your overall health and improve your bone. Also, caffeine, tea, and soft drinks like sodas contains caffeine, which may decrease calcium absorption and contribute to bone loss. Choose these drinks in moderation. Remember to take care of yourself. Eat a healthy, balanced diet. Reduce your alcohol intake. If you smoke, to quit smoking. Make sure that you're getting enough vitamin D. If you're not being exposed to the sun enough, make sure that you're taking supplement, but speak to your healthcare provider before you start taking it. Make sure that you are eating calcium-rich foods because this will help improve your bone health and make your bone dense to prevent osteoporosis. Limit your caffeine intake, and also make sure you are including regular weight-bearing and strength training activities to help you improve your bone health and to prevent fractures associated with osteoporosis or to prevent osteoporosis. Making sure you're eating a balanced meal is a good way for you to make sure you get all the essential vitamins and minerals that is good for your bone health, including your vitamin D, calcium, vitamin K, vitamin C, because they can help you improve your bone health, prevent other chronic illnesses, and prevent osteoporosis. Regular weight-bearing exercise such as weight training, walking, hiking, jogging, climbing stairs, tennis, and dancing all counts as exercise, and this can help you along with other healthy lifestyle management to improve your bone health, to prevent osteoporosis or help you manage osteoporosis. So thank you for watching this video. I hope you've learned something that can help you improve your bone health, improve the bone health of your loved ones, and to help you achieve the optimal health that you want in your life. So until next time, take care, stay safe, be healthy, exercise, eat a balanced meal, all for you to live a healthy, balanced life. Take care. Bye-bye. Stay safe.